Good morning, everybody. Thank you very much for having me here. I hate to be the bearer of bad news, but I don't have a PowerPoint for you. So, okay, good. Thank you. I was going to say I didn't want to do death by PowerPoint, but really I just didn't put slides together because I thought it would be hopefully more interesting to make this interactive. My plan is to give you about 10 or 15 minutes. Sort of organized into three areas. The first is to just do a primer on where CDPHE comes in as it relates to regulations for oil and gas operations. The second is to talk a little bit about the health effects and what we know, and generally more what we don't know as it relates to the health effects related to oil and gas operations. And then the third thing is to talk about the task force recommendations and some of the legislation that just passed. And anywhere along the way, if anybody has any questions or if anybody wants to correct me because I said something incorrect, which could happen, is likely to happen, then please do so. I do want to give my disclaimer, of course, is that I'm not an attorney. I'm not an oil and gas guy. I'm a pediatrician by training. Admittedly, when the governor appointed me to this role, I said, well, I have a lot to learn as it relates to the environmental health side of the operation. And he said, don't worry about it. You're smart. You'll pick it up. You'll learn from folks. You'll have plenty of time to do that. And I was supposed to start on the job on a Monday, and he called me on Wednesday before and said, could you start tomorrow because we're about to experience the 100-year flood, and there's a big environmental health component to that, and need you to kind of get going right away. So needless to say, I had a learning lab on my first couple of months on the job, and have enjoyed it ever since. And so doing these kind of things, of course, is also very important to me, but also enjoyable. So I do want to also introduce, for anybody who doesn't know, Kent Custer. Kent, you'll have to stand up. Sorry, I'm going to embarrass you. Kent is our oil and gas liaison at the Colorado Department of Public Health and Environment. And so Kent really is our eyes, our ears, our expertise, our conscience as it relates to oil and gas operations. So if you don't know Kent, please make it your point to get to know Kent, because he really is a treasure for us at the department. And just to embarrass him even further, don't look down and shake your head. This past month, Kent, out of all 1,300 employees that we have at the Department of Public Health and Environment, was voted our Employee of the Month. So from the regulatory standpoint, I was going to try and do this and quiz you all, and whoever got the answer right would get a piece of candy, but I didn't think that would be right for the Director of Public Health to give out candy. So we'll just kind of go through this. But first, and I like to divide it up by water, by waste, and by air. And it is confusing. I think it's confusing for folks to try and figure out, well, when do I go to COGCC, or when do I go to CDPHE, and is this local authority, is it state authority, is it federal authority? So one of the things that I've tried to do at CDPHE, and what we're trying to do is really try and simplify things so that there's kind of a no wrong door approach. So if you come to CDPHE with your question or your issue, that we'll be able to handle it, whether we handle it primarily or whether we refer you to COGCC or to the local authority. And I'll talk more about that as it relates to the task force recommendations and what our plans are in a couple of minutes. But as it relates to water, I think water is one of those confusing things, because CDPHE is involved on the front end, on the construction side, or on the well development side when it comes to stormwater permitting. And as soon as that's completed, then we turn it over to COGCC, and really it's their responsibility with regard to groundwater and groundwater protection and regulation. CDPHE has kind of the umbrella with regard to the Water Quality Control Division by setting standards. We're also responsible for discharge to surface water, so any discharge from ongoing oil and gas operations that goes into rivers and streams and surface water is regulated and managed by us. And so it's an important distinction there, but again, we have sort of these niches, most of which were created as a result of federal regulations, and then some as it relates to state. When it comes to hazardous waste, hopefully everybody knows that E&P waste from oil and gas is exempt by and large from CDPHE's classification of hazardous waste. And so where we come in are a couple of nuances. One is if the waste is taken to any kind of commercial landfill or waste facility, then that's something that comes in under our purview and something that we regulate. And then the other is if that waste is not exclusive to the oil and gas industry or oil and gas production. So pit liners, for example, if those are needing to be disposed of, then those are considered solid waste, and those then come in under CDPHE's rules and regulations. Again, a little bit of a niche. It can be confusing with regard to, well, who do I go to for what? But by and large, those are the big categories there. And then the third is air, you know, like it or not, CDPHE is pretty much exclusive when it comes to regulations specific to air quality. And last year, you know, the example there, of course, is the methane rule that was passed by our Air Quality Control Commission. And so we really, you know, we're non-discriminatory when it comes to the air that we all breathe, and making sure that we try to set the appropriate standards when it comes to air quality. And so, yes, there are some specific standards that have to be set or that we've set for oil and gas operators just because of the nature of their emissions. But again, it comes to us to set those standards and put that in place when it comes to the air quality piece. So example again, the methane rule of last year. We have our own set of inspectors, our own set of infrared cameras. COGCC has their own sort of set of inspectors just for operations in general. And so sometimes then people get confused about, well, why do we have to have two separate sets of inspectors and also then permit processes and things like that. So generally speaking, it's primarily related to air and when air is involved. And then after that, it's those other nuances like we talked about. So that's kind of the thumbnail on where CDPHE comes in from a regulatory standpoint. I want to talk a little bit as my second piece here about health effects because it tends to be somewhat controversial. So it can be a misleading topic for folks on one side or the other. So I always like to start with the extremes. And so the first question I'll ask is, does anybody think that drinking motor oil or standing over some sort of oil and gas vapor constantly isn't harmful to you? Does anybody think that that wouldn't be harmful? Okay, good. Y'all get a piece of candy virtually for that. And does anybody believe that they would be at any risk or increased risk for illness or disease or cancer if you lived in an area where there were no industrial operations going on? Increased risk. Okay, good. So you got that right too. So, you know, so those are the extremes, and we try not to deal in extremes because the extremes really don't reflect reality. You know, the reality of the situation is we all have to live somewhere in the middle. And it can be kind of complex to try and figure exposure out. And that's the key word in all of this is exposure. At what exposure or what kind of exposure would oil and gas operations cause some sort of health effect? And what do we know about that to date? So the first thing that we're trying to get a handle on is really, again, back to our area of expertise is air, and trying to look at emissions. And I want to pander a little bit to Garfield County and Garfield County commissioners for helping fund to the tune of $1 million or more very significant air studies here that really do help contribute to what we're trying to learn about the health effects of oil and gas operations. And the way this works, so that people know, is because, again, we can't take a bunch of people, sit them around a well, and wait and see if and when they develop some sort of health effect or health impact. It's just really not practical and not ethical. And I always tell people, think about like marijuana that way too. People ask us about the health effects of marijuana. You're not going to put somebody in a room and have them start smoking a lot of pot or eating a lot of edibles and waiting to see if they pass out or what's going to happen to them. So, people develop models, health impact models, as a result of what we know. And so what we know is, I say, an inventory of pollutants that might end up in the air. And this is, again, a study here in Garfield County. It's been done a couple years ago. We have an ongoing study now. CSU has been a good research partner for us on a lot of these studies. And you take that data, and then you model it to see what the health or the potential health effects are as a result of modeling air emissions data. And so a few years back, we had some Garfield County data, and we had some Front Range data. And the data wasn't very good. And we tried to model, and the School of Public Health tried to model based on that data. So some of you may recall there were two different studies that came out. One through CDPHE that said there would be 100 more cases of cancer per million people for people who are living in kind of oil and gas rich communities. And the School of Public Health said there would be 10 more cases per million. So actually, for once, the School of Public Health came out a little bit, less aggressive than CDPHE did on this. But it's because the data from the air emissions really wasn't very good. So the good news is we expect a really good inventory of air emissions to come out within the next year. And so with that, we are then going to get funding so that we can go ahead and do the modeling and really determine what the risk is and what the health impacts are as a result of different levels of air quality around the state. Because we know that some areas have different inventory of those pollutants than others. The Front Range, for example, here, the northwest part of the state. And then there's a lot of impact to that. There's climate, there's topography, there's wind, there's all kinds of things that sort of play into that. So the other challenge that people get into is, you can't just go out and measure one day and say, aha, see, on that one day, emissions were high, so there's a problem, or emissions were low, so there's a problem. It really has to be a longitudinal impact. And like I said, we know that there are things like irritant effects from some of the pollutants related to oil and gas, as well as other types of industry. So we're not trying to sort of disprove that. We're really trying to sort of say, what's the actual health effect, health impact, and try and give people reasonable or responsible information. You'll hear things like endocrine disruptors. That is very popular here in Garfield County to study the potential endocrine disruptors. Anybody want to go for 5 pieces of candy and tell us what endocrine disruptors are? Oh, really? Go ahead. No?
Either natural or industrial exogenous substances that turn up or down your hormone system.
Great. That's like 10 pieces of candy, I think. I don't know. Yeah. And so
That was the elevator version.
that was great. There might be a job for you at our place. I don't know what you do now, but he's what?
He's at Harvard.
He's at Harvard?
Yeah.
Oh, great. Maybe you could trade up and come to CSU. I don't know. Okay. So, the thing about endocrine disruptors is, trying to sort of figure out where they come from. So, of course, people want to sort of point fingers and say, well, this is obviously from oil and gas, but endocrine disruptors are things that might affect your hormone system. It can come from, agriculture. It can come from, naturally occurring sources and other sort of industry that is in and around the area. So it's very difficult, and we believe to date that nobody's made any kind of association there with regard to exposure to oil and gas and endocrine disruption. The other one that was interesting was last year, Dr. McKinsey's study, which came out around oil and gas and the potential that the closer you live to oil and gas operations, the greater risk you had for certain types of birth defects. And, that was the headline. But even Dr. McKinsey herself, stated very clearly in the paper that there were a lot of shortcomings to this study. And really the bottom line was, this is interesting, but we need a lot more study. And just so you know, the shortcomings were they used all types of wells, whether they were inactive or active. So there was no way of knowing if they were measuring folks who lived near shut-in or inactive wells. The other thing they used was where these women delivered these babies, because that was how they could get the zip code information. Well, we know that some people, especially in rural areas, travel quite a distance to a hospital to deliver, and that's not necessarily a metric for where you live. Remember, like I said, longitudinally, not like just one and done, but where you live long term as it relates to where those oil and gas operations are. So lots of questions still to be answered. I always tell people, like anything else, avoid the extremes, because it's going to be somewhere in the middle. And like I said, once we get this inventory of air pollutants, we'll be able to model some health risk assessment, which is the proper way to really look at what the health effects potentially could be. So then the last thing, and then I'll let Matt talk, and then we'll take questions afterward, is just where we are with the task force recommendations and some of the legislation. And so we were very fortunate that we got actually bipartisan and bipolar support for all of the things that we thought made sense with regard to the concerns that people might have as it relates to oil and gas operations. The first is a few years ago with kind of the boom in operations, we were pretty far behind with regard to conducting inspections and making sure that we could keep up with our role as it related to the air and the regulatory compliance piece. So we were allowed a temporary increase in staff. Part of the task force recommendations and then what got approved was that we could convert that temporary staff now to permanent staff. So we have 11 folks that we didn't have to let go that we could keep on there, and those 11 folks are responsible for somewhere in the neighborhood of about 2,000 inspections a year. I know that might be bad news for some of you, but it's good news for us that then at least there's not necessarily a backlog, and we can keep up with our role there. The second piece is, as I mentioned before, trying to sort of be this no wrong door or no wrong window. So we are going to set up this clearinghouse, this helpline. And originally, we were going to do it just as it relates to health concerns, but now, like I said, it's going to be broader. So anybody with any concern as it relates to oil and gas questions, health or otherwise, can call us. And we will handle the health ones, but we will make sure that COGCC or local entities or whoever the most appropriate place or person is gets that. So that, again, there's a single place that we can field those calls and act as that clearinghouse. And so that was approved, and there'll be a website to go with that, so it's not just by phone, but we'll use social media, we'll use phone, we'll use website. And then the companion piece to that is approval and funding for a mobile air station. We have stationary stations throughout the state, but again, a lot of people get concerned because they'll say, oh, I'm in a neighborhood where there's a lot of oil and gas operations, or what about this school that's located, less than 3/4 of a mile where somebody, is starting operations or whatever. So we'll have the ability to go out with a mobile station and set up and assess and do some measurements, and I think by and large provide reassurance to communities as a result of having this station that there's really not anything out of the ordinary or anything to be concerned about. On the flip side, obviously I think you all included, if we do find something to be concerned about, then we want to know that, right? So that we can address it and see what that's due to. So that was approved as part of the legislative package as well. And then the last thing is, again, this health risk assessment. But since we won't get the air pollution data until later in this year, the health risk assessment wasn't yet funded in this budget year, but we gave the Joint Budget Committee a heads up that it's going to be in next year's budget package. So they gave preliminary approval a year in advance for however, whatever that's worth. So with that, I'm going to let Matt give you his side of the story, and then we'll take questions after that.